Today's hearing sounds the alarm on the tremendous loss of taxpayer dollars to fraud and the real consequences for patients, providers, and the public trust. Together, Medicare and Medicaid provide health coverage to more than 140 million Americans, including seniors, people with disabilities, low-income families, pregnant women, and children. These programs are lifelines, not abstract budget figures. When they are exploited and plundered, Americans lose access to care, confidence in the system, and resources intended to improve those health outcomes. Each year, tens of billions of dollars are lost to fraud, waste, and abuse. But financial loss is not only the consequence of these fraud schemes. When providers bill for services never rendered or criminals flood Medicare or Medicaid with fake claims, the system becomes harder to oversee, less responsive to legitimate patients, and financially unstable. Healthcare costs rise for everyone, and trust in these critical programs erode. Operation Gold Rush illustrates the growing scale of the problem. This recent nationwide enforcement action by the Department of Justice was the largest healthcare fraud takedown in history. This operation targeted several healthcare fraud schemes, leading to criminal charges against 324 defendants in 50 federal districts and 12 state attorneys general's offices across the U.S. The various schemes involved over $14.6 billion in intended loss. 29 of those defendants were charged for their roles in transnational criminal organizations that used stolen identities of over 1 million Americans, spanning all 50 states, to submit over $10 billion in fraudulent claims to Medicare for durable medical equipment that patients never ordered or received. Many seniors learned that their Medicare or other personally identifiable information had been compromised only after being denied legitimate care. This is not an administrative error. It was organized crime exploiting our nation's healthcare programs. We must ensure taxpayer dollars are used for quality healthcare, not siphoned off by criminal enterprises. Republicans took steps in this in H.R. 1, and we must continue the effort to preserve Medicare and Medicaid for those who need these programs.